So it's important to understand the benefits from Medicare for skilled nursing facility. Certainly before you end up in a skilled nursing facility, you need to understand what your coverage is so you know how things are going to be handled and we don't have any surprises. And obviously if we're headed to a skilled nursing facility, we don't want any surprises. So when we're talking about skilled nursing care with Medicare, we're not talking about long-term care. We're talking about rehab. So where you would go if you say you had a stroke, or if you had hip replacement, or something where you needed rehabilitation to gain improvement before you go back home. So it's really important to understand because there are two completely different ways that this can be handled within Medicare. And the main differences are whether you're on original Medicare with a Medicare supplement plan or whether you have chosen to go with a Medicare Advantage plan. So we need to understand what we need to know before we get there. So first thing to understand is the coverage. So Medicare covers the first 20 days in a skilled nursing facility at no cost. So there's no co-pays, no co-insurance, covered under Part A. From day 21 to 100, they also cover, but there's a $200 co-pay that goes along with it. Obviously a significant amount of money. Now the good side of that, a Medicare supplement or a Medicare Advantage plan usually covers that out-of-pocket expense. So pretty much there can be up to 100 days of coverage in a skilled nursing facility. Now, keep in mind, in order to qualify for skilled nursing care, there's other parameters. So what needs to happen is you need to have at least 3 days inpatient hospital admission to qualify for skilled nursing care. Now this can get a little crazy and a little gray, and I've seen it happen many times. When you're in the hospital, you could be there a day or 2 days or 3 days, and you certainly think it's inpatient because you're there, you're staying the night, but hospitals can classify it as observation as opposed to inpatient. And I really don't have the answer as to why they do it as observation because it doesn't make a lot of sense. But if it is observation, you wouldn't qualify for skilled nursing care or rehab after the hospital stay. It has to be inpatient hospital admission 3 days or more, and then you get discharged to a skilled nursing facility for rehab, again, after a stroke, after hip replacement surgery, knee replacement surgery, something significant where obviously you can't just go home. You need rehab to be able to get back to where you can take care of yourself. So here's where we reach the problem. With original Medicare, with a Medicare supplement plan, generally it's not a problem. Generally the doctor makes the decision. If you need to stay, you're going to stay, and they're going to pay. Medicare Advantage is different, where the decision lies not with the doctor, but with the medical plan. They make the determination on whether or not you're going to be able to, whether or not they're going to pay for you to stay in a skilled nursing facility. So I'm going to go through an article here that's in the Kaiser Family Foundation. They published it, very creditable third-party no obligation group that covers a lot of senior stuff and Medicare stuff, and this article gives a breakdown on how things work and how they differ. So we start here. After 11 days in a St. Paul, Minnesota skilled nursing facility recuperating from a fall, Paula Christopherson, 97, so she fell, she was in the hospital for a number of days, released to a skilled nursing facility, as anyone would expect, was told by her insurer that she should return home. But instead of being relieved, Christopherson and her daughter were worried because medical team said she wasn't well enough to leave. This seems unethical, said her daughter, who feared what would happen if the Medicare Advantage plan run by United Healthcare ended coverage for her mother's nursing home care. The facility gave Christopherson a choice: pay several $1,000s to stay, appeal the company's decision, or go home. You don't want to be in that position at 97 where you just are recuperating from a fall, and those are your choices on what you can do to continue your medical care. So it's certainly a scenario that makes things very difficult. The article goes on to say half of nearly 65 million people with Medicare are enrolled in private health plans called Medicare Advantage, an alternative to the traditional Medicare program. The plans must cover at a minimum the same benefits as traditional Medicare, including up to 100 days of skilled nursing home care every year. But the private plans have leeway deciding how much nursing home care a patient needs. In traditional Medicare, the medical professionals at the facility decide when someone is safe to go home, said Eric Krupa, an attorney at the Center for Medicare Advocacy, a nonprofit law group that advises beneficiaries. In Medicare Advantage, the plan decides. So it's super important to understand that you are not guaranteed your benefit days at a skilled nursing facility if you are on a Medicare Advantage plan. So you want to be well aware of that for sure on how it's going to be handled. Myreed Painter, a vice president of the National Association of State Long-Term Care Omnibudsman Program who directs Connecticut's office, said people are going to the nursing home and then very quickly getting denied and then told to appeal, which adds to their stress when they're already trying to recuperate. So that's crazy that you have to appeal while you're in medical crisis at a nursing home in order to be able to stay at the nursing home. So it's certainly complicated and makes things much more difficult than they need to be. The problem has become more widespread and more frequent, said Dr. Rajiv Kumar, Vice President of Society of Post-Acute Long-Term Care Medicine, which represents long-term care practitioners. It's not just one plan, it's pretty much all of them. So this appeals process, just how much does a person want to fight is where it comes down to, where we're probably going to cover it, but you're going to have to put up a fight if you want us to cover it. And we're hoping that you're really not going to put up that much of a fight. So they play the odds, and that's kind of how it works, which is, it's really unfortunate. And I've had just too many calls from people that have had a husband or a wife or a sibling or a friend in a nursing home that is being told that they have to go home, and they're not ready to go home, and they want to know how to get off the Medicare Advantage plan and get back to original Medicare. And in most states, you can't. If you're in a health situation, you won't be able to. You could come back to original Medicare during an open enrollment period, also another time-locked scenario, but you likely wouldn't be able to get a Medicare supplement plan because of a health situation. One other quick story. Patricia Maynard, 80, a retired Connecticut school cafeteria employee, was in a nursing home recovering from a hip replacement. And believe me, hip replacement is almost common practice these days. If you make it through life without a hip replacement, you're fortunate. You're well above the odds. They have become very commonplace. And obviously, after a hip replacement, you're not going to jump up, go walking, and get in your car and drive home. You're going to need rehab to be able to get back on your feet and do the things that you're supposed to do. So hers was in December when I don't know why they keep using United Healthcare as an example, but they do, plan notified her it was ending coverage. And her doctors disagreed with the decision. If I stayed, I would have to pay, or I could go home and not worry about the bill. The average daily cost of a semi-private room, that's with a roommate, is $415 a day, according to a state survey. But going home was also impractical. I couldn't walk because of the pain. So Maynard appealed the company, and the company reversed the decision. But a few days later, she received another notice saying that they decided to stop payment again over the objections of her medical team. The cycle continued 10 times. So she had to appeal 10 times. And each time they said, okay, you're okay. And then they denied it again. And again, this is not a rare occasion. This is a pretty common occasion. If you know anybody that works in a nursing home, just ask them how it's handled under that type of situation. And I spoke with somebody that worked in a nursing home, and they said what they have to do is every day fill out a form on why the person needs to stay, and the Medicare Advantage representative makes a determination on whether or not they agree. And if they don't agree, they don't pay. And then it's on the patient to figure out what they're going to do from there. On original Medicare with the supplement, it's almost reversed, where they might keep them there too long because they want to continue to bill Medicare, which is also not a great scenario, but likely better to have overcoverage than certainly undercoverage. But that is how things function. And if you've had any experience with it, please leave a comment in the video below. Help others understand that this is how things work in skilled nursing care. So first off, you have to qualify. You have to have 3 days of inpatient hospital admission. So observation doesn't count. Has to be inpatient. And then difference between being on original Medicare with a supplement, where it's pretty much what the doctors say. Now, you can make the decision yourself to go home if you're ready to go home, and they're saying, no, we want you to stay a little longer because we're getting paid for you to be here. That's certainly a case as to where it can happen, but you can always make the decision where you're ready to go home. Medicare Advantage, they're going to make the decision on whether you're ready to go home or not. So kind of crazy on how that functions, but that's a big reason that I just don't offer Medicare Advantage, because I don't want this type of situation to come back to me and say, why did you set us up with this kind of plan where my spouse or sibling or loved one, whatever it may be, is now in jeopardy because they're being booted out of a skilled nursing facility. So I hope you understand how this works. I hope you find it helpful. I'm going to show you right now how to download my book. Have a fantastic day. Thank you for taking the time to watch my video. I hope you found it very helpful. A couple of other things that you'll also find very helpful. Number one, download a copy of my free book, Medicare Made Clear. I spent a lot of time and a lot of effort putting this together, and it has everything that you need for Medicare now and in the future, down the road. I have videos in the book. I have all the links that you need for things that you'll want to do within Medicare. You can access it right in the book. Very easy to do. Just visit medicareonvideo.com/free book, and you can download it for free. You can save it on your computer. You can save it on your iPad. It's a great resource to have, again, for now and in the future. Another thing that you'll find helpful is down the road, when you come into Medicare, sometimes it makes sense to do a price check on your Medicare supplement plan. So I made it very easy to do that as well. Just visit medicarepricecheck.com. Put in your basic information, and we'll email you a quote on your same plan that you have right now, a G or an N or an F, whatever it may be, and likely we'll be able to save $20 to $60 a month in premium, because a lot of times plans come out with better rates. So if we can get a better rate for the same plan that we currently have, just makes a lot of sense. And then obviously take advantage of all the information on my website at medicareonvideo.com. I have everything that you need right there for understanding IRMA, understanding employer work coverage, everything that you need, especially in the guides and forms section, you'll find right there. So we update everything every year, so everything should be up to date and current with the right deductibles and premiums and things like that. Hope you found all this helpful. Have a fantastic day. Wait, don't go anywhere. There's a couple more videos right here that you'll find very helpful with your Medicare journey. So take just a minute, watch the videos. You can also subscribe to my channel by clicking this button, and that way you'll have access to all my videos for everything that you need for Medicare. Hope you find it helpful. Have a fantastic day.